Alright, 24. Patient with burns to their upper back, anterior side of their right arm, and anterior side of their abdomen. I got 22.5. Upper back would be 9, anterior side of their right arm would be 4.5, and then anterior of their abdomen I've got 9 as well. 25. This is a repeat of 52. It's Cushing's triad. What are the 3 parts and what does it indicate? Hypertension, bradycardia, and irregular breathing. Indication of herniation into the brain causing ICP. 26. What's the purpose of the medulla oblongata? Responsible for the autonomic functions such as respiratory and circulatory system. Also helps regulate sneezing, swallowing, and digestion. What's the purpose of CSF? It is produced from arterial blood by the choroid plexus by combining the process of active transport, diffusion, and penocytosis. The volume of CSF ranges from 140 milliliters to 270 milliliters. It acts as a cushion that protects the brain from shock and supports the venous sinuses. It also carries waste products away from the brain and nutrients to the brain. It also plays an important role in homeostasis and metabolism of the central nervous system. 28, what is herniation? Is when something inside the brain grows, inside the skull grows, and produces pressure causing brain tissue to move. 29, what type of injuries may, in what type of injury may a popliteal artery be damaged? It's a knee injury, it's a continuation of a femoral artery. 30, what is a common skull fracture that involves the base of the skull and provides a rough surface with countertooth type injuries? I wasn't 100% sure on this one, but basilar skull fracture is what I put. Typically the most serious of all skull fractures, presenting with periorbital ecchymosis or battle signs. 31, what is the difference between anterograde and retrograde? Anterograde amnesia is the inability to recall events after the event that caused the amnesia, and retrograde is the inability to recall events prior to an event that caused amnesia. 32. What action happens when a patient with significant head trauma is hyperventilated? Hyperventilation of that patient with head trauma exacerbates cerebral ischemia. 33, what is the difference between spinal cord injuries? Contusion, concussion, laceration, hemorrhage, and transection. Contusion is a region of tissue or skin where capillaries have been injured. It's a bruise. Concussion is a traumatic brain injury caused by blunt trauma to the head. Typically results in brief unconsciousness. Laceration is a jagged cut or tear in skin or flesh. Hemorrhage is an escape of blood from a ruptured blood vessel. And transection, I didn't get a great definition on, but I just put a lateral cut or break. It's basically transected spine, completely cut in half, or cutting your body in half, transection. 34, what are the most fractured ribs? The 4th through 10th rib are most commonly fractured. 35, how much fluid can cause problems with pericardial tamponadis? If increase is slow, the pericardium can increase in size and hold up to 2 liters of fluid. However, if the increase is rapid, as little as 200 milliliters can cause tamponadis. And then 36, what is the greatest amount of inhalation burn injury due to? I got smoke inhalation.
Okay, let me take you back to 132. How did they answer that question again?
32?
Yep.
Hyperventilation is of a patient with head trauma exacerbates cerebral ischemia.
How does that do that?
Good question. I got that one.
Go ahead.
No, I've got it later on.
Okay.
Okay.
You got your partner covered, huh?
I got him covered.
Good, let's go.
Later on.
Can I ask real quick? I thought the most fractured ribs were 4 through 8.
4 through 8 is what's in your book.
Okay, 4 through 10 is acceptable.
Now stop asking that.
And the test is I think it was like
It was
10, 5 through 10.
It was 4 through
It was
10 or
4
3 through 8.
Or
4 through 8 was
the
come out.
test, and then
Stop,
practice
stop,
was different.
stop.
So when there's no more hemoglobin for oxygen to your chest tubes, right? That's what we're talking about, right? No, we're talking about Rick. Sorry, I was still on the other question.
You're 5 minutes behind, okay?
That's nothing new.
Hang on just a second, folks. So what does your book say in terms of fracture of ribs?
4 to 8.
4 through 8. That's what I want to hear.
Tim, where'd you get yours at? Did you get it out of the book?
I was looking,
Book in Google.
Googling.
Google. Dr. Google. Yeah, I'm recording.
What's that?
Okay, 137. What is rhabdomyolysis? Rhabdomyolysis is a degenerative process where the release of toxins from cellular death and anaerobic metabolism are introduced back into systemic circulation in irregular concentrations. These toxins include myoglobin, which is a muscle protein, phosphate and potassium from cellular death, and lactic acid from anaerobic metabolism. What is subcutaneous emphysema? It is the presence of air in the subcutaneous tissue. What is compartment syndrome? Normal pressure within a muscle. Normal pressure within a muscle compartment is near zero. Compartment syndrome is when outside forces cause inner compartments to build pressure, swell, causing ischemic damage to muscles, cells, tissues, and restrict capillary blood flow. Irreversible damage occurs after about 10 hours. 140, name signs and symptoms of attention pneumothorax and what will you do to treat it. Attention pneumothorax is an open or simple pneumothorax that generates and maintains a pressure greater than atmospheric pressure within the thorax. This can be caused by trauma, congenital defect affecting the respiratory tree, or by positive pressure ventilation. Signs and symptoms include chest trauma, severe dyspnea, ventilation perfusion mismatch, hypoxemia, hyperinflation of affected side of the chest, hyperresonance of affected side, diminished breath sound, cyanosis, diaphoresis, altered mental status, JVD, hypotension, and hypovolemia. It's corrected by needle decompression through the chest wall to convert attention pneumothorax to an open pneumothorax. What is the difference between Gray-Turner sign and Cullen sign? Gray-Turner sign is ecchymosis in the flank. Cullen sign is ecchymosis and fluid loss around the umbilical area. 142, we're going to go into acid-base balance. Patient has a pH of 7.15, HCO3 of 24, and PCO2 of 57. What is the patient's acid-base state and how will you treat it? Patient has respiratory acidosis, and we're going to ventilate this patient. 143 is the patient has a pH of 7.50, HCO3 of 30, and a PCO2 of 40. What is the patient's acid-base state? I've got metabolic alkalosis. 144, a patient has a pH of 690, HCO3 of 16, PCO2 of 60. What is the patient's acid-base state? As metabolic acidosis. 145, a patient has a pH of 7.35, HCO3 of 24, and a PCO2 of 40. What is the patient's acid state? And I've got he's clear, he's in hemostasis. You are to administer 146. You are to administer 250 milliliters of normal saline, 1.5 hours using a 15 GTT drip set. How many drips per minute will you run the drip set at? So the way I did this, I put 250 milliliters times the 15 divided by 90, which is, I took that down to the minutes, and I've got 41.66 drips per minute. What is the simplex form of communication? A simplex System transmit and receive on the same frequency but cannot do both at the same time. And 148 is how do you treat a patient who has a crush injury? I really couldn't find exactly if a crush injury. Is that yours?
Yeah.
Oh,
Want me to do it?
perfect. Yeah, please. Because I mean, in my mind, I know what I'm going to say, but I really couldn't find it exactly.
So, hang on just a
It
second.
was in the article.
Yeah, hang on just a second. Jason, let me take you back to number 141, Gray Kerners and Cullen signs.
Uh-huh.
We didn't talk about it extensively, but what do you think that indicates, either one of those injuries?
Seatbelt.
Yeah, seatbelt is a classic sign for it.
Right, so that would be across the umbilicus area, and as far as which one, wait, what number was that?
141.
141.
I would be looking at more towards kidney issues
Yeah, so.
in the other side.
You're kind of there. The idea in terms of a whole lot of energy that creates those energies can be something as simple as a seatbelt, but it also indicates the idea that there's been a huge shock, blunt trauma to the abdomen that's going to create that. So huge energy within that abdomen that you get out there. Let me take you to 144. pH of 6.9, HCO3 of 16, PCO2 of 60 is what?
I put hold on.
You're partially right.
I put metabolic acidosis.
Metabolic and respiratory. So it's a PCO2.
Right.
So it's both a metabolic and a respiratory acidosis.
Okay, I didn't realize it could be both, I suppose. So I apologize.
It'd be like cardiac arrest. You're super dead.
This is cardiac arrest, Jack.
Yeah.
Carolyn, whenever you're ready.
Number 148, how do you treat a patient who has a crush injury? Manage the airway, continuous ECG monitoring, coordination of compartmental release and return of reperfusion, manage the patient's core body temperature, manage kidney output by hydrating the patient with normal saline, manage the pain, administer sodium bicarbonate, administer mannitol, and rapid transport. Number 149 is a repeat of number 115. Number 150, define shock, the inadequate cellular perfusion and oxygenation. 151, how are the legal duties of a paramedic determined? Duty to act is defined as either a formal contractual or informal obligation to provide care, including the requirements and expectations, such as duty to respond, duty to obey laws, duty to provide care to expected statutes. Standard of care is generally established through law and legal cases, published codes, standards, criteria, and guidelines. 152, what are public health agency police powers? Laws that allow public health entities to act on the general interest of the public in cases such as epidemics and disasters, where the interests of the public outweigh the interests of the individual. Number 153, what is an injury surveillance program? An ongoing systematic collection, analysis, and interpretation of injury data essential to the planning, implementation, and evaluation of public health practices. Number 154, what is a calculation of subtracting the age at death minus 65 a concept of? This is a concept used in epidemiology to determine years of productive life. 155, what is the narrowest part of the adult airway? The glottis or glottis open, the glottix or glottic opening, which is housed by the thyroid cartilage and bordered by the vocal cords. In pediatrics, the narrowest part is the cricoid cartilage. 156, how long should an intubation attempt be limited to? Each attempt should be limited to 20 seconds. Number 157, what does a pulse oximeter reading reflect for hemoglobin in the body? Determines the oxygen saturation status by measuring the bound hemoglobin or oxyhemoglobin against the unbound hemoglobin or deoxyhemoglobin. Number 158 is a partial repeat of number 137 with the addition of when might you find a patient with rhabdomyolysis, and that would be with crush injuries. And number 159, what are the causes of decreased CO2 elimination, decreased hemoglobin concentrations, inadequate alveolar ventilation, decreased diffusion across pulmonary membranes, ventilation perfusion mismatch, hypoventilation, increased CO2 production, respiratory depression, and airway obstructions.
Carolyn, let me take you back to number 148.
Okay.
On crush injury.
Yes.
So I appreciate that you guys, the article that I gave you to read, I appreciate that they point out mannitol as a possibility, but the likelihood of you all curing mannitol is pretty minute. So what other drugs, Carolyn talked about sodium bicarb, what else? Albuterol, and what else? And calcium, no epi, calcium. Calcium especially, calcium and bicarb especially.
All right, 160. Fair warning. I had one book to go off of this and 2 hours of sleep. So
There's no whining here.
Check my
Just move on.
answers. 160, we already answered the tidal volumes, the amount of air that is inhaled and exhaled in a single respiration. Normal volume is 500 mLs, and dead space is 150 mLs. 161, name 4 causes of secondary brain injuries. I believe that's cerebral ischemia from brain swelling, hematoma formations, hypoxia, hypotension. That was pretty Google. Oxygen paradox, 162. What's oxygen paradox concerning treating the patient in shock? That's where they need to have the oxygen, but if you give it to them, it's going to worsen the symptoms of hypoxia. So we only want to give enough O2 to correct the hypoxia and restore normoxia, normal. And that's because the fully saturated hemoglobin can cause free radicals resulting in oxidative stress. 163, what's the reperfusion concept seen in treating a patient in shock? So, to me, I think that was pretty similar to the other one, where it's the absence of oxygen and nutrients from the blood during the ischemic period creates a condition in which the restoration of circulation results in inflammation and oxidative damage through the introduction of oxidative stress rather than restoration of normal function. So, kind of similar, probably. 164, describe how to locate the 3 sites for starting an IO using the Easy IO device. The proximal tibial tuberosity is going to be about 2 finger widths below the tuberosity and towards the midline, just below the knee. The medial malleolus is going to be about 2 fingers width above the inner ankle bone. This is the malleolus towards the midline there. The proximal metaphysis of the humerus is going to be the midshaft, with the patient's hand more towards on the umbilicus. It's going to be a midshaft humerus, 2 fingers below the shoulder girdle. Approximately at the humeral head is identifiable by the protrusion, which is the base of the greater tubercle. 165 is pretty similar to 69, but it deals with the therapy side of it. So, an allergic reaction, circulatory overload with too much infusion of the solution, thrombophlebitis, thrombus formations, possible air embolisms, and necrosis. 166, describe what happens with hypertonic and hypertonic states within the body. This deals with the diffusion and osmosis. So a hypertonic is going to cause water to come into that area as the hypertonic goes to this higher solution goes to the lower solution area, which displaces the water, which makes the water go to the other solution area. So trying to explain that to you, it's hypertonic causes solute to move from the higher concentration of solute to the lower level. I equals flow of water goes the opposite of this, causing cells to shrink or grow respectively. 167 was eliminated. It's another tidal volume. 168 is what is cavitation in yaw concerning penetrating trauma. Cavitation is the outward motion of tissue due to a projectile's passage, resulting in a temporary cavity and vacuum And a yaw is a swing or wobble around the axis of the projectile's travel. 169. Name the 5 components of the fifth principle and relate a patient condition to each component. It's going to be adequate concentration of inspired oxygen. Kind of a problem would be a hyperventilation. Appropriate movement of oxygen across the alveolar capillary membrane into the arterial bloodstream. I think that's COPD. Adequate number of red blood cells to carry the oxygen. I think that's anemia. Proper tissue perfusion, which is shock. Efficient offloading of oxygen at the tissue level. Compartment syndrome, I guess. 170, what are the differences between 1, 2, and 3 degree burns? First degree is going to be superficial burn. It involves only the epidermis, produces pain, minor edema, and red skin. Erythema. Second degree is going to be partial thickness burns, involves epidermis and dermis, produces intense pain, edema, white to red skin, blisters, moist and mottled skin. Third degree burn is going to be also full thickness burns. It involves all skin layers and possibly structures beneath. You had mentioned that there was also a fourth one, which would be the bones and muscles, but the book just was saying third. Little or no pain at that, but the tissue around it is going to have the pain. The tissue is destroyed, has a white, dark brown, or charred leather-like appearance, hard to the touch, and skin grafting can be required due to dermis destroyed. 171. What is a fasciotomy, and when, under what conditions would your patient need one? Fasciotomy is a surgical procedure that cuts away the fascia to relieve tension or pressure from a compression injury to a limb to help prevent tissue death. Fasciotomy is a limb-saving procedure when used to treat acute compartment syndrome. It's also sometimes used to treat chronic compartment stress syndrome. Similar injury occurs in high voltage electrical burns where deep tissue damage occurs. 172, what type of mechanism of injury is a traumatic asphyxia? And that's a crush injury resulting in severe compression force applied to the thorax. Creates a reverse blood flow from the right heart into the superior vena cava and venous vessels of the upper extremity.
Got a quick question, Charlie or Jerry. Fasciotomy and escharotomy, what's the difference there?
Same mechanism, one for compartment, the other one is for
Okay.
So on the test, it was escharotomy.
So Charlie, let me get through a couple ones. Number 161, 4 causes of secondary brain injuries. You knocked some of them, and we've been beating on this drum pretty good. 4 causes of secondary brain injuries. What is a secondary brain injury once again?
161.
It's not what we cause, but it's things that we can see.
Something
So-
associated with the initial injury.
Exactly. So what we talked about was hypotension, hypoxia, hypothermia, and hypoglycemia. We saw on the podcast from Weingarten Company also about coagulopathy. Acidosis was the 2 other ones added to that.
You said hypertension, hypoxia, hypothermia, and what else?
What we've been talking about is hypotension, hypoxia, hypothermia, hypoglycemia,
Hypoglycemia.
acidosis, coagulopathy.
Did you say hypertension?
I did say that.
Hypo.
Hypotension.
brain injury?
Mhm.
That doesn't make sense. Can you explain that?
I sure can.
That's
What happens
the
when
vagus
somebody,
nerve.
what happens when somebody becomes hypotensive in terms of blood vessels to the brain?
Oh, so not with the traumatic brain injury, right?
Yeah, but see, come on guys, I've been talking about this for 14 different times, okay? Secondary brain injury is about what? Not something that happens because of the accident, but things that we can see that comes afterwards, okay? Hypotension, can we do something about hypotension? We can get fluids, right? Can we do something about hypothermia? We warm them up. Can we do something about hypoglycemia? We give them glucose. These are things that are associated with what comes after the head injury itself.
I thought this said name 4 causes of secondary brain injuries.
Uh-huh.
Okay.
These are all causes.
You were telling me treatments for it, so I just
Well,
wanted to
I'm
make sure I
telling you
understood.
causes as well,
Okay.
but both causes and treatment. Let me take your 163, Charlie.
Okay.
What is the reperfusion concept seen in patient with shock? You're right, it is kind of associated with the previous question, but the difference is that 162 is about oxygen, giving too much oxygen for free radicals that create further damage. 163 is about running IV fluids. So remember we talked about that somebody that's been shocked, they've got dead cells, that we're now loading it up with a bunch of fluids, only to make this worse, so we compound the problem. So one's about oxygen, the other one's about IV fluids. Thank you. Number 166, the difference between hypertonic and hypotonic states, you kind of got there. Hypertonic is a shift from intracellular to extracellular, while hypotonic is from extracellular into intracellular. So you were right in terms of going back and forth, but that's a little more specific.
Number 173, what is a pulmonary contusion and why might it be a problem with trauma patients? A pulmonary contusion is a soft tissue contusion affecting the lungs. They are present in blunt chest trauma and account for 39% of respiratory failures. Pulmonary contusions are also frequently associated with risk fractures and can range in severity and change rapidly, resulting in a mortality rate of about 18%. Number 174, why is velocity worse in trauma than body mass? Velocity is worse in trauma than body mass because if you double the speed of an object, its kinetic energy also doubles. What is subcutaneous emphysema and when would you suspect it and how would you determine it? Air trapped between the layer of skin resulting in crackling when pushed on or air bubbles under the skin. You would determine it by touching it, feeling it, hearing the popping and palm palpation suspected with a pneumothorax. In hemostatic regulation, what is the effector? The part of homeostatic regulation that responds to commands to reinforce or oppose the stimulus. What is an initial homeostatic response that reinforces the stimulus? Positive feedback. What is cytology? Cytology is analyzing the internal structure of individual cells. Name 2 different terms for towards the head, anterior and proximal. What are alpha and beta cells located in the islet of Langerhans responsible for the production of glucagon? What is the massing process? Attachment for allowing the movement of the head. List the 2 formed elements of blood. There are 2 of the formed elements of blood: platelets, red blood cells, and then white blood cells. The pelvic girdle is included in what division of the skeleton? Appendicular. What is consequentialism? You can't know if your actions are right or wrong until you know the consequences. What is the difference between osmosis and diffusion? Osmosis is an active transport process across the cell membrane and osmotic gradient from the area of lesser to greater concentration. Diffusion is the movement of solutes from one area of higher concentration to lower until the substances scatter evenly through available space. It is a passive process.
Did we already have that one?
Yep.
Well, you're welcome. For reinforcement.
Sarah, is that all you have? All right, so let me take you back to number 180. What's the difference between alpha cells and beta cells?
Beta dilators and
Alpha and beta cells in the islet of Langerhans. What's the difference between them? You're partially right. Alpha cells is about glucagon. What's beta cells about? Production of insulin. 2 different things. One's about glucagon, the other one's about insulin.